Good afternoon, everyone. Welcome to this MBA Town Hall. My name is Lynn Ingram. I am first Vice President of the Nashville Bar Association this year, and I'm here to welcome two people. First, we have Bob Mendes, who's going to be hosting us today. He wears two hats in his day job. He's a member of Sherrard Rowe Voigt Harbison, which is where he practices a mix of commercial litigation, business bankruptcy, and transactions. He is also an at-large member of Nashville's Metro Council, and most recently, he was chair of the council's Budget and Finance Committee. He serves on the Charter Revision and Affordable Housing Committees. Bob was president of the Nashville Bar Association in 2011. He was president of the Nashville Bar Foundation from 2012 to 2014 and chair of the board of Nashville Electric Service in 2015. So many of you already know Bob, and we're glad to have him here hosting us today. And we are thrilled to have joining us for this discussion, Dr. Alex Jahangir. He has recently been in the news, mostly for this COVID-19 situation. And when I was searching him, I found his Facebook post where he was recorded getting his vaccination. So we hope to hear a little bit about that as well. Dr. Jahangir is a Vanderbilt surgeon. He's an orthopedic surgeon, and he is now the medicine, he handles medicine and infectious diseases. So there's a connection there, and he'll explain that to you in his role that he's doing now. He is the director of the Division of Orthopedic Trauma as well at Vanderbilt, and we are delighted to have him inform us about COVID-19 and all that he has to say. So welcome, both of you. I will remind you all, if you don't have this information, you can post in the chat. Bob will be monitoring that. We also have Nashville Bar staff who will be working on that as well. And we encourage you to engage and tell us your thoughts and questions. Thank you.
Thanks, Lynn. Dr. Jahangir, thanks for joining us today. We've got about it's scheduled to go 30, 45 minutes. And like Lynn mentioned, anybody can drop a question in the chat and we'll try to take care of it. I thought I would just dive right in by asking Dr. Jahangir to tell us how orthopedist ended up being the face of response to an epidemic.
Yeah, thanks so much. First of all, I have to say, often when I know I'm in front of so many attorneys as a trauma surgeon, my heart starts beating, and it actually surprisingly still is here. No, in all sincerity, thank you all for being here, and I will try to make everything more likely than not to be the right answer. So there you go. Those are the only attorney jokes I got. That's it. So with that said, it is a question that I sometimes wonder myself, what the hell is an ortho trauma surgeon doing responding to COVID? And the answer is this. I was appointed to the Board of Health in 2017 and became chair of the Board of Health in October of 2019. And when I became chair, my main objective, interesting enough, was to do this for 1 year, to onboard a new health director. We were about to undergo a search for a new director, something that I have done for other organizations, so it's kind of in my wheelhouse. And I was going to do some of the not so glamorous stuff of helping update the Metro Charter to make sense for health in 2020, public health 2020. Because the Metro Charter regarding public health was really in the 60s. So not very glamorous things. I was my plan for 1 year, and I was going to go off and do surgery again. But obviously, COVID hit in March 7th, 2020, if you guys remember, is in the first case of COVID hit Nashville. Our new director was scheduled to start his first day on March 9th. And so I was asked to be at my first ever press conference, ever on March 8th. And so I went and with this new director, my commitment was to him and to our city to help kind of let's come up with a plan for the city. I don't think any of us really expected we'd be here a year later at that time talking about things. But in my role generally as a surgeon, and you guys probably know a lot of surgeons, really our job is really good at operationalizing things. Okay, so we quickly realized we had to do certain things. I brought together a group of healthcare leaders early in the week that right after COVID hit our city, really started making plans. And then on Friday, so first press conference was Sunday. On that Friday, the mayor asked if I'd take this little bit bigger responsibility. And that is a somewhat short answer of how the heck orthopedic surgeon become a COVID thing. And as was mentioned, I mean, as you know, Councilmember, I still think my role is to operationalize and to bring people together and do things need to happen. And that's, I think, how I've been able to stay here. So thanks.
Well, for everybody who's watching, I know we've all seen Dr. Jahangir on the news through this last year, but I got to tell you, from the seat in the Metro Council, he really has been a wonderful, had a wonderful ability to bridge the gap between 700,000 citizens in Davidson County wanting to know what's going on and the fairly technical aspects on the medicine side for the epidemic. And frankly, he's also been good for when there's been at different times really equity issues about how different groups are being treated. One of my first stops is to go to him, and he's got a good way of pulling that off for somebody who's in a volunteer position. That really he's somebody who deserves all our thanks through this. Let me switch to talking about what's the current status of, and we'll get to vaccine a little bit later, but let's get a little bit into the weeds on statistics. How are we now as a city compared to when it started, compared to last summer, compared to the holidays? Where are we headed now?
I'm so glad we're having this discussion today and not 2 weeks ago or 3 weeks ago. We're coming off our third wave, and it's the third wave we've had nationally, so we're not necessarily unique here. We now have 3,162 active cases in Nashville. And to put that in perspective, about 3 weeks ago, we were at about 8,500 active cases, meaning more than 1% of the city's residents. And the numbers I always say are residents in Nashville, right? There could obviously be more people coming out, but we have now dropped. This is the lowest we've been since I think the beginning of December, which is really great. Our rolling average. So the way I look at 7-day rolling average per 100,000. That's the best way to kind of make it so we can compare here to Boston to Waverly County. Our 7-day rolling average is now 39, which is the lowest it's been in a long, long time. And at one point I think we were 80 to 90 again a few weeks ago. And then what is equally as important for me is the percent positive rate. So we're averaging about 3,500 cases a day. And out of that 3,500, about 8.4% are turning up positive. Again, if we're below 10, we're happy. But this is also in a place where we now are testing. We're about to come upon our millionth test conducted in Davidson County, which is amazing because when we first started, and you and I spoke about this, I actually remember being at an assessment site trying to figure out how the heck we're going to get swabs. And I remember being on a phone call with you. I was trying to figure out how the heck to get a swab to do test number like 10. And now we're about 1 million in. And then the other two metrics, I'll just not to geek out too much of it here, but our transmission rate is 0.82. And if transmission rate is 1, that means it's flat. So if we're having 100 cases today, you should expect 100 tomorrow. But if it's anything below 1, so 0.82, means that our trend is heading in the right direction to get rid of this disease. And then finally, and I think really critically, is hospitalizations. And in this city, our hospitalizations today are 287 people in Nashville proper hospitalized with COVID-19. At our peak, we're about 600-700 in just Nashville, not even surrounding areas. So all heading in the right way. And that's good. So I'm really happy about that. So that's a long spiel there.
So one of the things that I know people talk about and think about is how we compare to the state. And I don't know that a lot of people around here necessarily care what's going on 150 miles away, but we definitely all care what happens 25 miles away in the surrounding counties. And are there differences in the numbers now between where we're at with the surrounding area?
No, I'm really happy to say that it looks like the entire region is heading down. So Davidson County right now is probably 12 25th or 30th in disease activity for the state. There's been times in the summer, we were first for disease activity. So we were the worst. And then it flipped over the past several months where we were probably in the 60th and 70th in the county. So right now we're probably 20, 30 when you normalize it for population. So we're consistent with everywhere else, which is great because that means the entire state is heading in the right direction. We just crossed the threshold of 10,000 people dying in our state. Nashville has just shy of 600 people who've died. So, if you think we're 10% of the state, we're just maybe a little less than 10% of the death. So maybe we're doing a little better mortality rate here in Nashville compared to other places in the state. So our mortality rate's better, but overall disease activity is trending in the right, same as most places.
And those rankings you were talking about, that was out of the 95 counties in the state. Yeah. All right. Can we talk a little bit about what there's so many orders that change so frequently. It's I had somebody ask me today, so what's the rule for restaurants now? Yeah. Could you summarize what the current state of rules are?
Yeah, sometimes. So the current state is, first of all, last call is at 11 with last patron in at midnight. That's the most recent change we did earlier this week. If you don't serve alcohol and you want to be a 24-hour restaurant, like Waffle House, for instance, you can do that. We're still at 50% capacity of fire capacity, and no more than 8 per party, and that's kind of where we're at right now.
I was in Chicago a couple weeks ago with my high school senior, trying to look at a campus in the middle of COVID, and notably, Chicago, I understand it's changed now, but a couple weeks ago, they still had no seating in restaurants at all in the entire city. How have you guys tried to balance the competing interests between, frankly, politics, the tourism economy, medicine? How have you guys tried to balance those?
I just say very carefully and move on to the next question. No, it is, again, for me, I make no qualms that I'm new to this world, having to balance all of that, right? But what we try to do is, you've heard us say, try to let the science and the data drive it, and a lot of it has been that. For example, when a lot of places early on were shutting down hairstylists and the gyms, and all the bars and all of that, we initially did, but then we started turning the dial a little bit and allowing certain things to come back. And I know people would like to have more gym access or more of this. I get all that, but what we started seeing is, okay, you know what? We're not having to spread in gyms as everywhere else. So let's open up more gyms. Same thing with restaurants and bars initially. Hey, we're not having the spreads here, so let's open that further. And then when you started seeing clusters, as I'm sure everyone on this call, probably more sophisticated than a lot of just general population, have saw that we had to sometimes turn the dial down. So it really is looking at what's the science out there, what is being shown locally and overall in the nation as causing spread, and then seeing if that makes sense for what we do. So it really has been, sometimes we've been successful and at doing it at the right pace. Sometimes I think we've probably gone slower than we should have. Sometimes we have gone faster than we should have, and we've all seen the outcomes of those. So it really is fine-tuning all that. If you know me, and you know that for me, I recognize the financial impact that this has caused. Prior to this role, and somewhat concurrent with this role, I was the chair of the Adventure Science Center board. So it's an organization that means a lot to me growing up and now in my adult life. And we made a decision to close that place about a week before the safer at home orders in general in Nashville. And then somewhat through the pandemic, I had to look at a list of 41 individuals we laid off out of 70 or so. And I knew a lot of those people. And when we've now reopened, some of these people didn't come back. And so it hits home for me. I get it. But it's that fine balance of sometimes admitting you did something maybe you could have done better. And so that's how we try to balance it.
Well, from the council member perspective, I can always say that's the health department's decision, not mine. So thanks for taking the fall for that. Let's talk a little bit about the vaccine. And as a starting point, yes, I heard Dr. Hildreth at Meharry talk in the last couple of weeks about why there are 2 shots and why they have to be, why it's important for them to be sequenced the amount of time apart that they are. And since that's so much of what the vaccine is making sure there's 2 shots the right time apart, matching with supply. Can you just talk a little bit about the medicine behind why there's 2 shots and the timing?
Yeah, so the Pfizer and Moderna vaccines are out there, as many of you have heard, are mRNA vaccines, which is new technology for vaccines, not necessarily new technology. What it does, it literally takes a mRNA sequence, puts it in your arm. Your body then takes that mRNA sequence, makes a cell that's not actually virus, but has the spike proteins. Like literally, you've seen a picture of coronavirus, like little spikes. Your body recognizes that spike, starts making antibodies. And so essentially the first shot primes the pump with antibodies for that spike. When you put the second shot in 3 to 4 weeks later, so 3 weeks for Pfizer, 4 weeks for Moderna, then again, once the cells, your body incorporates mRNA, makes a fake coronavirus, your body sees this, and that prime pump then just goes crazy and just starts building. It's about 1,000-fold response compared to the first time. And I'll tell you, my second shot probably impacted me more than anyone else I know. I mean, my body did its job and really knocked me out for a day, but no more than a day. And so that's why 2 shots are important. And currently the sequence is what the studies have shown. Now, there are some new studies that people are trying to do, say, can you spread it out a little bit? Can you do Pfizer one day and Moderna the next time? That's to be seen. But right now, I don't recommend any change from what has been proven to work. What has been proven to work for those 2 viruses, or for those 2 vaccines, is a 95% effectiveness. So if 100 people in the placebo got sick, only 5 in the people who got the vaccine got sick. Furthermore, and what I think more importantly, no one had to be hospitalized, no one had to die, and no one had what's considered severe disease that would result in those 2. The new Johnson & Johnson vaccine, which I hear is going to be the authorization is going to be reviewed at the end of the month, is a 1-shot thing. It is not mRNA. They actually take a virus, a non-impactful virus, as the carrier of the coronavirus stuff. It goes in you, and then it just works differently. It's an adenovirus carrier, but it's 1 shot. You may read it's 70% effective. What I want to highlight, that means that if 100 people got sick in the placebo group, 30 got sick in the Johnson & Johnson arm. And actually, I think it's really up to 80 if you look at the data further, or so only 20 got sick. But nobody in this group, again, got severely sick. They had to be hospitalized. No one died. So again, I think that is amazing. Plus that virus is 1 shot, much easier transport characteristics. So I'm excited that's going to come out too. So I hope that answered the question in the science.
It does. And I wanted to illustrate the point that at least for the 2 vaccines that are out now, the matching supply with being able to do the second shot in the right window is critically important. If you miss that window, it's really not getting the same benefit. And I have heard that the Johnson & Johnson one should turbocharge the ability to
I think that's right.
Get vaccine out. Well, so all of us have got relatives, friends, parents, neighbors, people we go to church with, who are asking the question, when can I get vaccinated? And I know that's probably the hardest one that you probably get these days, but so what is the deal about how do people know when they can get vaccinated? So
it is such a great question. Let me kind of fill people on where we are as a city right now. Again, of the 700,000 Nashvillians, about 54,300 have received at least 1 shot. About 25,000 received their second shots. Now, if you remember, phase 1A is essentially all healthcare workers, first responders, some people with developmental disabilities, mortuaries and so forth. Nashville has a lot of those individuals. So a lot of people got that first. So I think we're also doing 75 and over. So if I can, let me kind of tell you where we are with that and then answer your question. Of those 75 and over in Nashville, 15,000 individuals have been vaccinated. So that is it's a little more than 43% of the people over 75 in Nashville. We've done that through Metro Public Health. We have now Music City Center. We've had Lents. The hospital systems have helped. If we just talk about disparities for a second, of the individuals who are white over 75, 39% of those individuals have received vaccine. Of the individuals who are Black over 75, about 20% of those individuals have received vaccine. Hispanic ethnicity, it's about 23% over 75. So we're working to get it out there.
While you're talking about the fairness stuff, let me just blend in another question that I was going to ask later, and you can build that in.
And then I'm going to answer your question, I promise. When are you going to get it?
That's all right. I just this morning was looking through the slides that we get every day as council members, and we get one slide that'll show the geographic dispersion of the disease, and another slide that shows the geographic dispersion of who's been vaccinated. And it really is stark when you see it in a picture. At this stage, the highest concentration of illness is in lower income parts of town, still concentrated out in Antioch. And for the vaccine, the zip code with the highest amount of vaccination percentage in the county is 37205, middle of Bellmead.
Yeah.
And so go ahead.
So I'm glad you said it. And I'm still going to come back to when you're going to get the vaccine.
Right.
What I tell people, so I want to, if you know me, I mean, I get it. The disparity thing is critical. But one thing that I think is critical for people when they analyze the data is think about, again, by state rules, we can only have provided vaccines to healthcare workers and so forth. Most healthcare workers, or the predominance of healthcare workers, tend to be young white females. Also, I would assume a majority of healthcare workers live in the zip code you just talked about. And so that's why, at least early on, when there's only been 15,000 people, which you want to call general population, who've been eligible, so 75 and over. If there's a way to break down that I think will give you at least a more appropriate, is the distribution fair or not? Because right now, I think if we look at overall, again, 15,000 have been general population. That means about 40,000 are fit this healthcare category. And I think there might skew the data. Now, back to when can you get a vaccine, or anyone here? So we follow the state's phasing guidelines. It's very critical for us. I mean, if we want to continue our relationship with the state, the federal government gives it to the state, who then gives it to us. And the partnership has actually been really good. About 4 weeks ago, we were getting about 5,400 vaccines and 5,800 vaccines and 7,200. And then this past week, we were supposed to get 78, and they gave us 9,000. And next week, we're getting even more. That's getting better and better. So with Pfizer, with Johnson & Johnson hopefully coming out at the end of the month, that also will get better. So we have, the state phasing has the 1A, 1B, which is teachers, 1C, which are anyone 18 and over with any kind of medical problem, and then it goes from there. There's also the age phase thing. So 75, states moving to 70. We're going to try to move to 70 soon, because we have gotten through probably about 40 to 50% of our 75 and over population. As I mentioned, 41%. But as we get through that wait list, and there's ways we're getting through that wait list, Music City Center, I also have a second clinic that's kind of getting through a few hundred a day, kind of off the wait list. We're going to move to 70 and over. Now, teachers, it's something that's really important for me. We'll have more information next week, but I've really working with some people. I want to try to make that a little faster than maybe people were thinking it may be, because again, I recognize the critical nature of that. And then I hope the state will continue to provide us more and more vaccines. So all that being said, if you have a health condition, which a lot of people, they're worried about that, right? I have an autoimmune disease, I have hypertension, I have obesity. That's Group 1C. My hope is that by March, we can roll into Group 1C here in Nashville. And then come April, May, we can even roll further beyond that. But 1C is the group that once we get to that point, people who really are at really high risk if they get this disease will hopefully have access. So
let me ask a follow-up, and then I'm going to hit some questions that showed up in the chat. I know this has been a moving target, so not holding you to it, but just sort of a best estimate as of today, based on your best guess about the pace of vaccine coming out. When will we get that enough people are vaccinated where really things should be okay?
It is a great question. And I'm stalling in this for this reason. So I think honestly, I still believe by summer, so June, July will be at a good place. But here's the thing. Nashville, we have 85,000, so 86,000 people who've been infected out of 700,000. So let's say 14% have been infected. And when you're infected, you have immunity. Now, almost 8% of the city has been vaccinated. Now, there is some overlap, so it's not perfect math. But let's just say, that's 20% of the city has immunity. There's probably some people have been infected that never knew they were infected or never reported it. So there's probably a little higher up. So let's just say there's lower 20% of the people in the city have protection. The scientists will say if about 70% of a community has protection, whether through vaccination or through being ill, you'll have immunity, herd immunity. So my hope with all that being said is midsummer. The key though is if a vaccine becomes so available and people don't get it, it's irrelevant. So we need to message, especially as leaders, as you all are, we need to message safety. We need to message why it's important. I work in a hospital system, and I operated with a guy this morning, my scrub tech, who refused the vaccine. I just don't get it. So anyway, hopefully summer. So there you go.
I had an annual physical a few weeks ago, and I chatted up the nurse, the doctor, and the woman who pulled blood. I got to the woman who pulled blood, and she didn't believe it was safe, so she wasn't going to do it. Blew my mind. I won't name the facility. All right. What I'd like to do in our remaining time is I'd like to ask you a little bit about schools, and then we've got 4 or 5 questions lined up in the chat that maybe we can get through those. But let's talk about schools first. And I'll ask a couple different questions and let you talk about it. One is, what are we going to do? Like, where are we at? What's going to be happening with schools here in Davidson County? And then secondly is, there's been fairly high profile scuffling between state authorities and local authorities. And, I'm sure you as the medical guy, you just wants the right answer and none of that, politics BS. Like, how does this all fit together, and where are we headed?
So, school's been, my introduction to politics, schools has definitely been a learning process for me. So I'm sure many of you can figure that one out, right? Here's how it fits. So as you know, when we talk about schools in Nashville, about 75, and Councilmember, you probably know this number better than me, 75-80% of students are metro public schools, or maybe, and then the rest are private, parochials, and so forth, right? Is that roughly?
Yeah.
So it's really, we're talking about, I view it as the whole gamut when we have this conversation. So let's say 30%, if that's a fair number, have been in session. What we have seen in Nashville is, for the most part, there's not been much inter-school spread. There are school activities. So for example, kids will go have a sleepover or something like that, where they do have spread amongst each other. But in school, while there has been some, it's not zero. It's not been 100%, or it's low. It's really easy. And in full disclosure, my children go to university school. I'm on the board of university school. And I know that a school of a little over 1,000 that has a lot of resources and the investments that we've made to, in that, again, one building, to put the barriers and HVAC. It's easy for me to say, hey, USN's done it right, it's fine, everyone should be able to do it. Now when you go to MNPS, you have 100 something buildings, you have 70, 80,000 students, staff. It's just a different scenario. So I think.
Buses.
So do I think schools should be open? My answer is I think schools should be open with the right resources, right? I do. And so MNPS, and I really have not been involved in the MNPS decision, but they're approaching it as they're approaching it. Now, what I do have ability to try to impact is to try to see if we can roll to phase 1B, so vaccinations. And again, the estimation was that we were going to do that at the end of the month or March, but I'm hoping that we can maybe move that timetable up sooner to give those teachers that want the vaccine that opportunity. It's not just teachers, right? It's the janitors, it's the bus drivers, it's the food services people. There are a lot of, there's no zero spread. I think people say there's absolutely zero spread in schools is wrong. I think if a child has it and gives it to an adult that has some issue, that adult can die. And you've seen educators die. I'm not saying those people got it at school, but there are people who are educators by trade who got COVID and died. That's a factual statement. So schools it's a tough situation. I understand the need to go to school, not go to school. Well, I get it all. I think with the right resources, schools should be open. And within my power, I'll be able to try to give at least what one part of that right resource.
Yeah, I think that is the challenge. It's the resources. I think the people do point to the statistics coming out of the private schools, but usually that doesn't include a discussion of the volume of resources the private schools are putting into spreading out classrooms, having more room to do that, and it's just I think that's a bigger lift for MNPS to be able to do. All right, I'm going to try to hit a bunch of these questions in the chat. There are a few that are around reinfection. One person asks the odds of getting it a second time, and then I think a related question is how long can we expect the vaccine to be effective?
So I don't have the exact statistics on the odds of getting a second time. I've heard some people have gotten it a second time, and especially with new variants coming out. We've had 2 variants of the British variant, UK variant here in Nashville already. And there's some worry that may result, or at least a reinfection. Maybe if you've had it, maybe the impact is less because you already have some immunity. So I'm sorry I can't give you the exact answer. It's not zero, but typically if you get infected a second time, you really had it the first time, it's not going to be as virulent. As far as how soon will you need a vaccine, nobody really knows yet. Some of the studies have shown it may be a 2-year thing. Some say, gosh, maybe a 6-month thing. And I'm like, that's kind of, both numbers are out there. Some Moderna's like, well, we'll get a 3rd shot that'll make you immune to the South African strain. I'm like, hell, let me just get 1 shot in people's arms before we talk about the 3rd shot. So long answer to your question is I hope it's no more than annually. And if it is, I think we will then be in a place just be like a flu shot where every year you may go and get one. COVID's going to be around. It's going to be endemic, right? It's going to be like the flu. Some people get it. What we want to do is get to a point where it doesn't kill people and put them in hospitals. And hopefully with enough immunity, that will be the case.
Thank you. A few people have asked questions around the efficiency of getting all the vaccine that's available deployed. One person says it's estimated that only 60% of the vaccine coming to Tennessee is being administered. And another person asks, is waste of vaccine an issue? What do you think about that?
Yeah, regarding the numbers of how much is coming to the state and things. So I'll tell you, in Davidson County, we made, myself, Dr. Wright, and the mayor, we made a commitment. If there's a box of vaccines that's just sitting and not been allocated for somebody or some purpose, we're gonna find an allocation. So a few weeks ago, we had 975, just 1 box. That we were like, wait, when you did all the math, like we have 1 box left. Well, we started going to our wait list, right, and started knocking out people off our 75 and over list. When it comes to that math, I'll be honest. Listen, I think the people at the state, so Shelley Fiscus, who Dr. Fiscus, who runs the vaccine part for the state, They do a really good job. I think some of that math that you see sometimes has to do with second doses are coming into the state, and then in the transport time too, when they come to the state and they go to wherever the second dose needs to be administered. The math is done at that moment where it's being stored and not sent out. I don't think the state is holding back 40% of first doses. And that's the thing is, what's been good so far is, when you get a first dose, you're guaranteed your second dose. And sometimes that second dose, the state guarantees it when they get their second dose shipment from Pfizer, they'll keep it in storage and then just ship that second dose out. But I would defer to the state for specific numbers. But I'll tell you, in the city, we don't sit on first doses, and we don't really sit on second doses because we get the second doses either the Thursday or Friday before the next week when the second dose is supposed to be administered.
Thanks. There's a question that I've heard a lot of too, that somebody asks, especially with Nashville lagging a lot of counties in terms of the age-based distribution. It makes people wonder, how is the state deciding on the allocation? And that's basically driving at, are we getting shorted by the state a little bit, or are we being inefficient compared to other counties?
I would push back to anyone who says they're being inefficient. All day, I'll go toe and toe with anyone there, because I'm really proud of our operations that we've done. Music City Center, East Nashville, so forth. The question of, what I think is happening is yes, I mean, there's a little bit where we may be getting a little less per population than others. But again, this week is a great example. We were told, Dr. Wright and I were told, we're getting 7,800 doses of vaccine this week. On Sunday, we got an email saying, you know what, we found 1,200 more. And I suspect what's happening is they're like, hey, you know what, somewhere county, let's say Murray County. I'm not saying it's Murray County. Murray County didn't actually use the 1,200 vaccines that they had allotted last week. So we're not going to give them 1,200 more. We're going to ship that to you all because you all are obviously using them. So I've been very appreciative of the state, like increasing. And next week, I think we're going to break the 10,000 number. And, we've got them all allotted. I mean, we're ready we know exactly where they're going to go. And we're calling about 1,200 people off the wait list that we have for 75 and over. Here's the thing with that wait list is those people are also on the Vanderbilt wait list and the TriStar wait list. And the VA, a lot of people don't think about the VA. The VA gives vaccines, or the federally qualified health systems we've given vaccine to give vaccines. So a lot of people are on lists multiple times. Once we have a kind of comfort level that, all right, we've got a lot of the people who are 75 and over had the opportunity and they chose not to, that's one thing. We're going to roll over to 70. My hope is we roll to the 70 range consistent with the rest of the state in the next week or two. But there you go.
Great. And then somebody asks, basically some crystal ball gazing. Over the next 6 months, do you expect the trends to continue downward like they are right now, or are you expecting more?
I hope so. The big unknown and you hear people, people are really smart if it pans out, right? And if it doesn't pan out, nobody remembers who made predictions. Some people are real alarmist about the new strands, the British, the UK, and then which again, most of the vaccines are protective against, and then the South African, Brazilian, which is less effective. There is angst that those strains will cause a fourth wave. But I would then counter that if we vaccinate enough people, even if there's a fourth wave, hopefully it won't be a fourth wave of hospitalizations, and deaths. My commitment is to try to get everyone as vaccinated as quickly as possible and turn off of what this do, so we can get back to a successful, the successful city we've had. So I don't know. I still feel optimistic this summer we're going to be at a really good place.
Okay, great. I got somebody just asked a couple minutes ago what I think is a great question. This is another one, very practical. I'll just read this word for word. I'm aware of people over 75 who have registered in multiple counties and have been able to get a vaccination in those more rural, not even close counties. What does that do to the system? Should people do that And just ironically, I had a client that I was on a call with at 11 that told me that he got his first shot in Clayton County, drove 100 miles to get it. He's 74. Should people do that?
Yeah, why not? I'll tell you, it's less likely you can drive into our county to do that because we're a little bit more stringent. But if Clayton County isn't using their vaccine allotment, it's not Clayton's counties per se, it's the state of Tennessee's, right? And it works just the same if you get in Clayton County or if you get in Davidson County. But if you get in Clayton County, then the second dose is going to Clayton County. So you should go to Clayton County, because I think what will really short circuit the system is if you then try to bounce from county to county, because that I would not advise. But if Clayton County has the supply, you meet the phasing criteria, yes, you should go wherever you can get it. I would tell you, I mean, again, here in Davidson County, we're doing our best so that people in Davidson County can get it here in Davidson County. But if the uptake in these rural counties is not what it should be, you should go get it, frankly. Now, what I hope, though, is that people in these rural counties will understand that this is not a hoax and they should get the vaccine. So I hope that's as I joke sometimes, that's a problem for Dr. Not Me, right? Clayton County's vaccine hesitancy. But the problem for me is the hesitancy of vaccine here in Davidson County. And so education is critical. And I hope that people will take this vaccine if given the opportunity.
Great. And then I will add the last question in the chat isn't really a question. It's a thank you. It's somebody who has recently moved from Nashville to somewhere else and wanted to thank you and Metro for amazing job in the last year and a half regarding COVID. And I would, I've told the group, and I'll reiterate now, like Dr. Jahangir and I did not know each other before COVID. With my role in the council, his role as chair of the health board, we've had plenty of occasion to chat, and he's a busy guy, I'm a busy guy, and so usually our calls are just a couple minutes long and all business, and usually they've been around equity, either in the response to the disease, getting shelter for people who are homeless and don't have resources, getting hopefully moving toward being able to have some mobile distribution in more places around the county for people who might not have a easy way to get to one of the big hospitals or one of the big distribution centers. And I know everybody says it, but I don't know how you get work done with all the work you're doing for the citizens of Davidson County. So thank you very much for that.
Thank you. It's an honor for me.
And I think we've been going about 45 minutes now. I'll give a couple more seconds if anybody wants to toss a question in the chat. Otherwise, we'll ask Cameron from the Bar Association to come back on, and she can wrap it up for us. Thanks again, Doctor.
Really appreciate this, guys. Thank you.
Thanks. All right, seeing no more questions in chat, then it'll be a wrap. Thanks everybody for joining us today.